most forceful tone yet, addressing Canadians who are not complying with self-isolation and social distancing.
We've all seen the pictures online of people who seem to think they're invincible. Well, you're not. Enough is enough. Go home and stay home. This is what we all need to be doing.
Trudeau said that to Canadians. He then later spoke to provincial and territorial leaders about the possibility of invoking the Emergencies Act. That would be the government's final and strongest move. It would grant Ottawa exceptional powers that would override many provincial efforts to contain the outbreak. But it's another sign that containing coronavirus could take some very drastic action. We will see if he announces anything further to that effect today when he has his national address set for 11:15. But the whole question of flattening the curve and social distancing and self-isolating to avoid that big peak in cases coming into our hospitals and causing a collapse of the system potentially, how to flatten the curve through our own actions and in our own communities with social distancing and self-isolating. We are continuing to answer your questions about that. And this morning, we're doing it with our social media friends and partners and platforms at CBC. So you can ask me questions on Twitter, on YouTube, on Facebook. You know the usual ways to do that. And as well, you can email me and tweet me some questions as well. I have a couple of those. Answering questions this morning, back by popular demand, as I keep saying, Dr. Isaac Boga from his home in Toronto. He's self-isolating after some travel as well. Dr. Bogoch is an infectious disease specialist at Toronto General Hospital. He has been invaluable to us, helping understand the latest developments and information about the coronavirus, and he is here to answer your questions. Welcome back, Dr. Bogoch.
Hi, well, thank you for having me back.
Here we go, and we're just going to go as long as we can with this co-production with our social media pals. So I think Jared Saltz on Facebook has the best question with which to begin. What is self-isolating and who should do it?
Okay, so I think it's, there's a ton of information out there, and sometimes it can get confusing. The best thing to do is you can go to the Government of Canada webpage, and that will show you exactly what to do. It is totally not ambiguous. You're supposed to go home and be at your home for 14 days, and it's basically as simple as that. Now, of course, we know that some people might need to get groceries and take care of their basic needs. It's extremely important that we limit this as much as possible. And if we have at all a social safety network of friends and family that can help with this during this time, then now is the time to call in the help, because people, as the Prime Minister said, go home and stay home.
And I mentioned that you are in self-isolation because you came back from an overseas trip. Just in terms of specifically who is required to self-isolate, that is people who've returned from travel right now. Also, anybody who's had close contact with someone who may be exhibiting symptoms. Is that not right? Who else should be included in this group of people who should be self-isolating right now?
Those are the big categories of people, right? If you've had a contact with someone who is confirmed or possibly has this infection, or if you've returned from travel, and it's for a 14-day period of time. I mean, not to get too personal, but like, I've been home, and I'm here and for at least another, I think it's about 5 more days or so. And, I'm continuing to work. Like, obviously we're chatting now, but after these conversations, I have a clinic list to get through. I have patients to call and prescriptions to call into to pharmacies. So, I'm trying to be as productive as possible while at home. It's interesting because it's slightly different for healthcare providers. Now the hospitals have greater power and greater authority. And, thank God I'm not exhibiting any symptoms at all whatsoever. But, if I truly remain asymptomatic and if the hospital needs someone to come into the hospital to help out, they have the power to call in hospital staff to do so. So for now, I'm at home and I'm working from home, and I'll finish my self-isolation for the remainder of my 14 days, but I might be called in for hospital duty if need be.
At that time. And the Prime Minister himself in self-isolation as well, continuing to run the affairs of the country from Rideau Cottage. A question from Calithia on Instagram. I would like to walk my dog. Is this still allowed in this new framework of social distancing?
It's a great question. And, this comes up a lot. I think we have to, the short answer is it's probably fine, You can't truly be locked in your house. If you're not on self-isolation, but you're social distancing, so you're not supposed to be at home, you're not on a self-isolation protocol, but you're social distancing, I think it's totally appropriate to go out for a walk around the block. But I think it's extremely important that if people do that, we should keep it at a minimum. We should definitely be avoiding any other individuals and keeping apart by the 2-meter radius that we've been told. And it's funny because you hear sort of different things from different senior health leadership. Some people are saying it is okay to go out for a jog and for a run, but keep it at a minimum. And then when you're not doing that, stay at home. I personally think that's a very realistic approach because, you're still encouraging exercise. You're still allowing people out of the house in a safe manner. And I think it's extremely reasonable to do something like that.
It's interesting. We just heard that, Dr. Bogoch, from the UK lockdown. People are allowed out once a day to go for a run or a walk or some form of outdoor activity. But other than that, locked down tight. They have very strict measures in place. A great question from Austin on Twitter, wondering about this whole period of self-isolation and why it is 14 days. Why not 15? Why not 10? Can you remind us of what we know about this virus so far?
Yeah, absolutely. That's a great question as well. We know the virus has an incubation period. That's from the time someone's exposed to the virus to the time they may develop symptoms. And the vast majority of people will have symptoms about 5 days after they're exposed to the virus, if they're going to get the infection. And so the reason it's 14 days is because, most people, almost, there's not, in medicine, just like in life, nothing is 100 or 0%. But the vast, vast, vast majority of people would come down with symptoms. If they're going to get this infection, they would get this infection in within that 14-day period of time. And I think about 98 or close to 98% of people will have, who are going to get sick from this, if they're exposed, will have their signs and symptoms of infection at 11 days. And almost, not quite, but almost all people will have signs and symptoms of infection at the 14-day mark if they're going to get sick from this infection. So the 14-day mark is a very reasonable time frame, and it's basically the global gold standard for home isolation and for quarantine measures.
Okay. Many viewers and many people joining us on Twitter, on Facebook, and on YouTube are wondering, this obviously has big relationship implications, Dr. Bogoch. So is it okay to visit significant others, even though they're not living together in this time?
Yeah, I think we have to be extremely careful about that. And it's hard to micromanage every scenario, but I think those visits should be limited as much as possible. Having said that, there's going to be certain situations where people truly need help, either mental, emotional, physical, access to essential resources. And if we are going to start visiting other people, obviously, I think we should keep it to completely to a minimum and only for essential visits that they just need. And otherwise, I think it's best to stay in touch through phone or internet and video chats. That's the best way to keep in touch with people, and we should really avoid going to make visits right now.
I have a couple of specific examples that fall into this category of relationships and family arrangements that I want to ask about. People have been sending us pictures, and they've been kind of heartbreaking, in terms of grandparents who can't get to their grandchildren because they don't want to put anybody at risk. So from Lucy Chef sending in an email to us, if my husband and I are practicing social distancing, they're only going out occasionally for groceries and pharmacy, is it okay to babysit our grandchildren if they, in their family, are also practicing social distancing? In other words, children go from home to their grandparents' home. I'm thinking that you might say that might be something that should be curtailed.
Yeah, if at all possible, it really should be, because remember, when people are going out, even for the bare necessities like grocery shopping and going to the pharmacy, you're still potentially putting yourself in contact with the virus. And, the risk may be low, but it's not 0%. And I just think people need to be mindful about any of these scenarios where you're putting people together under one roof. Fewer is better, fewer contact is better, greater space is better. In the same breath, you have to I appreciate that there's going to be circumstances where it just needs to happen because there's no alternative. And in those scenarios, I think we should just do the best we can and mitigate risk as much as possible. But I think for the most part, if there's an alternative arrangement, they should certainly make those alternative arrangements. And the other thing is, we would not want people like grandparents, people over the age of 60, to come into contact with this virus. I mean, this is truly the most vulnerable population, and we should do everything we can to protect those individuals.
And we are hearing some very poignant pleas from the grandchildren of Canadians who have died of coronavirus already to that exact effect. Their grandparents are the most vulnerable, people in their 80s, in their 70s, heartbroken and not even able to be there at their death of their grandparents at that time. So it is very much something to bear in mind. Question from Danielle on Twitter into us, explaining that theirs is a family where one spouse works in an essential service, so that will continue. The other spouse works from home. So in the home, what should they be doing in terms of distancing and cleaning? Obviously, this depends on the size of the home, and that really gives you latitude and space potentially. But what's your recommendation for two people with very different lives right now, coexisting but still staying safe?
Yeah, I think the issue with there is that, you know, perhaps the spouse that's working and is part of an essential service has some risk of acquiring the infection and bringing it back into the home. So number one, the spouse that's out working really has to be as careful as possible to do everything he or she can to not get this infection. And of course, the place of work has to set this person up for success. You know, space people out at work, provide access to alcohol hand sanitizer or hand sanitation stations as well, and really ensure the work environment is as safe as possible. Now, of course, when that person comes home, there is some degree of nuance here. Mm-hmm. And this really boils down to people's risk perception, risk threshold. These are some very personal questions that people ask, and I think we're going to see a lot of individual differences in behavior. I think some people will say, you know what, the risk is too high, and we're going to sleep in separate rooms and use separate bathrooms and really separate ourselves at home. I think other people will say, you know what, I'm doing everything I can to reduce my risk at work. I come home, I change my clothes, I wash my hands, and so to further reduce the risk of, if I do have this on my body, to reduce the risk of bringing it into the home. And we're going to continue with some degree of normalcy at home. And, you know, as long as no one is exhibiting any symptoms whatsoever, I think both approaches are fine as long as we're aware of the, you know, risks, benefits, and alternatives of each approach. And these are just discussions that I think people should have with their spouse to see, you know, what is the best approach, what's the best approach for them, and also be open-minded that, you know, people can change their minds, and if people get uncomfortable with the current approach, they can always pivot.
Kathy on Instagram is wondering if we're supposed to, as the Prime Minister said, go inside and stay inside. What about people with health problems who need to see their doctors? Would that be considered an extenuating circumstance and people should be able to go out if they're comfortable going into a healthcare or hospital setting, I would guess?
Yeah, I mean, this is a challenge as well, right? We're really doing our best to provide the highest quality of care to our patients despite being in a pandemic for COVID-19. And, you know, like, for example, today, I have a huge clinic list today that I'm going to get through. I have a lot of patients that, you know, normally I would be sitting in my clinic on the 13th floor of Toronto General Hospital and be seeing lots and lots of patients. And of course, that's just not feasible and that's not acceptable right now. And, you know, there's no substitute for seeing people face to face. But we all have to sort of adapt to this situation that we're in. And most people, most physicians now are calling their patients and having conversations with their patients and, you know, calling in prescriptions and really doing, I guess we call this virtual care for their patients. And, you know, I've seen tons of clinicians adapt to this, and we're still providing good patient care. But, you know, obviously we'd much prefer to see our patients face to face. It's just not possible now. Having said that, there are, of course, situations where there's no substitute for seeing someone in person. If someone's very sick, or if someone just has, you know, a particular issue that needs to have eyes laid on it, and being creative with, you know, video chat or, you know, taking pictures is not going to substitute, then, you know, then you got to go see your doctor in person. Mm-hmm. And it's just extremely important to communicate how that can be done safely.
weigh the potential risks against the need there. That is a really sound advice. I just want to pause for a moment and say good morning to everyone as you watch on CBC News Network, but also as you're watching us on our social media platforms, Twitter and YouTube and on Facebook. We have a special co-production right now live with Dr. Isaac Boga, who's an infectious disease specialist at Toronto General Hospital, answering your questions, and they are excellent as always. But we're focusing on this whole notion of physical distancing or safe distancing, and also self-isolation. Who needs to do it? What are the circumstances and why? Curtis Palin has a question on Facebook, Dr. Bogoch. Is there a need to self-isolate for someone who is exhibiting mild cold-like symptoms? Yeah.
We're in a pandemic. It's unclear, what the true nuances of the signs and symptoms of this infection are. We know that some people can exhibit very, very mild symptoms. And, if you asked that question, 2 or 3 weeks ago, we probably would have said, no, that's, you just go about your daily life. But given the context in Canada now where we're seeing significant degrees of community transmission of this infection, and given that many people will have very, very mild symptoms, I think it's appropriate, if you have those types of symptoms, to self-isolate and go on a 14-day home isolation program. And in addition to that, I think it's very reasonable to call the local public health line to discuss how you can get access to diagnostic testing, and if you're eligible for diagnostic testing in your region, because it'd be helpful if you are. This is an answerable question, and I know that there is the rapid scale up of diagnostic testing across the country. We now have access to many more types of diagnostic tests. And we've seen this in Quebec. I mean, they just ramped up diagnostic testing yesterday, for example. So most parts of the country are ramping up diagnostic testing, and you might be eligible for a test. And if you call that local public health line, they'll direct you into the safest and best way to get that done.
Quebec even opened that drive-in testing facility right in the center of downtown Montreal, which really changed things. They did some 800 tests yesterday alone. You mentioned community spread. That was one of the big news headlines for today, Dr. Bogoch, and that is that nearly half of the cases in Canada now, 44%, are as a direct result of community spread, not travel-related, not close contact-related, community spread. So this is the added urgency to some of our discussion. Can I just, you're going to join me again in the 9 o'clock hour. So I'm going to pause in our viewer questions for a second, but you were mentioning, so if somebody who has mild cold-like symptoms, they are slightly different, the symptoms for COVID-19. What do people really need to watch for as they are looking at their own symptoms to help them understand what they might be dealing with here?
Yeah, I mean, I think it's going to be very challenging to make a list of symptoms and say, this is definitely not COVID-19 and this is definitely COVID-19. It's going to be very challenging to do that because, of course, there's going to be significant overlap in many syndromes like common colds, COVID-19, influenza. There's going to be significant overlap in many of these processes. So, in the current context, it's different if there's very little COVID-19 circulating, but in the current context of this pandemic, where we have a growing burden of infection in Canada, where we have significant community transmission of this infection in Canada, if you have symptoms, even mild symptoms, like even a small cough, that certainly could be it. That certainly could be a COVID-19 infection, despite not having travel, just by virtue of walking around and being a part of your day-to-day life, going through your day-to-day life in Canada. And I think it's appropriate to self-isolate in those situations, because if you do have this infection, the whole goal is not to facilitate transmission in the community.
Thank you so much for this conversation. Stand by with me, if you will, Dr. Bogoch, and we'll carry on after our 9 o'clock headlines. But thank you. I think we're going to end our co-production for now. Thank you for the questions on Facebook, on Twitter, and on YouTube as well. And you can certainly join in on CBC News Network. We'll continue that on with Dr. Isaac Boga, who is our infectious disease specialist from TGH. If you want to send some more questions for the next installment, again, Morning Live at CBC.ca, and we're on Twitter at CBC Morning Live.